Hi, welcome to Vita Veggie Services. In today's episode, we are going to be discussing hypertension. Yes, high blood pressure. Hypertension is often referred to as the silent killer. This is because it mostly develops without noticeable symptoms and progresses to functionally compromise our brain, liver, and kidneys. This prompts the need for immediate public awareness. Join me as we discuss the risk factors, the symptoms, and some lifestyle modifications to help us manage our blood pressures to boost a healthier well-being. For hypertension, we are going to be discussing terms like systolic blood pressure. Systolic blood pressure refers to the pressure that the blood exerts against the arterial walls when the blood is pumping blood or is in action. We are going to also be hearing terms like the diastolic blood pressure, which refers to the pressure that the blood exerts against the arterial walls when the heart is at rest. We are also going to be discussing terms like cardiac output. Cardiac output refers to the volume of blood that the heart pumps in every minute. And then we are going to be discussing peripheral vascular resistance, which also refers to the resistance against the flow of blood in systemic circulation. So, blood pressure is actually the pressure that the blood exerts against the arterial walls. And so, for every human being, the heart pumps blood to every part of the body through narrow tubes referred to as our blood vessels. So these narrow tubes actually offer resistance to the blood flow, and this resistance contributes to the blood pressures that we all have. So blood pressure reading takes the form A/B in millimeters mercury, where A, which comes first, is the systolic blood pressure, and then the B, which comes second, is the diastolic blood pressure. So, according to World Health Organization, a blood pressure reading of 120/80 millimeters mercury is considered optimal for a healthier well-being. In elevated blood pressures, the systolic blood pressure has a reading of about 120/129 millimeters mercury, with a diastolic blood pressure reading of less than 80 millimeters mercury. And in stage 1 hypertension, the blood pressure reading is 130/139 millimeters mercury for the systolic BP, and then the diastolic BP has a range of 80/89 millimeters mercury. And in stage 2 hypertension, the systolic blood pressure has a reading of greater than 140 millimeters mercury, and then the diastolic blood pressure reading also is usually more than the 90 millimeter mercury range. For hypertensive crisis or very emergency hypertensive cases, we have a blood pressure reading of about 180/120 millimeters mercury, and this prompts the need for immediate intervention. For the signs and symptoms of hypertension, I broadly categorize them into the ABCD system to help for easy learning. So for the A, we are talking about anxiety, asymptomatic stage, and then abnormal heart rhythm. For B, we are discussing things like breathing difficulties and buzzing in the ears. And C, we are talking about complications like the occipital headache and confusion. And for D, we are talking about dizziness and damage to the eyes or vision problems. And for E, we are discussing emesis, or that's vomiting, and then epistaxis, that's nosebleeds. Talking about risk factors, the risk factors of hypertension can be broadly categorized into modifiable and non-modifiable ones. The modifiable ones are those that can be altered, and they include alcohol intake, smoking cigarettes, eating diets rich in sodium, lack of exercise, and then increased body weight or obesity. And then for the non-modifiable risk factors, we are talking about age, sex, genetic predisposition like the Liddle syndrome. For the treatment options for hypertension, we broadly categorize them into the lifestyle modifications and then the pharmacologic treatment. For the lifestyle modifications, once again, I categorize them into the ABCD system. So for the A, we have alcohol cessation. B, we have the body weight management. C is to stop cigarette smoking. And D is to incorporate DASH diet that includes the legumes, oatmeals, and bananas. And E is exercise or activities. So, for the pharmacology treatment, we have antihypertensives like the ACE inhibitors and the angiotensin receptor blockers, which relax blood vessels and prevent kidney damage. We also have the calcium channel blockers, the beta blockers, and the diuretics.
For the nutritional considerations in the management of hypertension, we have the vegetarian and vegan diets. These are diets rich in fruits and vegetables and reduce in saturated fats. to help reduce blood pressure in both normotensive and hypertensive individuals and have the potential to reduce or eliminate medication use in some patients. Mechanisms underlying these results include a combination of the following. That's 1. Reducing or eliminating meat may influence blood viscosity. Numerous studies have linked beef, veal, lamb, poultry, and animal fats to high blood pressure. Saturated fats appears to influence blood viscosity. A prospective study found that vegetarians, especially vegans, have lower blood pressure even when body mass index is controlled for. 2. You have the increasing potassium intake. Potassium is an electrolyte that reduces blood pressure and stroke risk through improved vasodilation. Beet grains, spinach, potatoes, tomato paste, and ajuki beans are excellent sources of potassium. A meta-analysis of contributors to hypertension in Finland, Italy, Netherlands, the United Kingdom, and the USA found out that 97% of the risk for hypertension was attributable to dietary sodium alone. Hence, consuming a diet that is low in sodium, like vegetables, fruits, grains, and legumes, is very key in managing high blood pressure or hypertension.
Thank you.